We'll be starting shortly, giving everyone a moment to get on this morning. If you have any issues, technical issues, please message Harper Byers. All right. Good morning, everyone. We are so happy you're here today and joining us as we are going over the RFA for the RFA that we sent out and made you all aware of for a great opportunity that's in Connecticut. Again, we'll be recording this session. If you have any questions, get stuck along the way, please send a message to Harper Byers and she'll be happy to help you. For this session, everyone will remain muted. However, at the end, we will have time for questions. The session is being recorded. If you have questions towards the end, please use your hand. See at the bottom of your control panel, it has raise hand, or you can put it into the chat and we'll be happy to answer your questions. So today we're going to focus on identifying about the resources that are available as you guys are working on this application. We'll go over the FAQs of the questions that have been submitted. And like I said, we will have the floor open for questions at the end. So a little bit about us. My name is Teresa Dominguez, and I'm a senior program manager with the School-Based Health Alliance. Our job, our role, our focus is to support school-based health centers across the nation and help to grow school-based health centers. We focus on policy, standards, data, and training. We look at the intersection of health and school and where SBHCs make a difference. Some of you may be new to school-based health centers, and some have been doing this for many years. We welcome you all as we talk more about this opportunity. I'm going to allow Christine to talk a little bit more about Connecticut Department of Health.
Hi all, thank you for joining us today, and thank you for the School-Based Health Alliance for doing this wonderful presentation. So I work in the School-Based Health Center program at the Connecticut Department of Public Health, and we have contracted with the National School-Based Health Alliance to oversee and distribute the funds for this project. If you have any questions along the way about the application or the project, or once you do get started, you can contact the Alliance directly about those. The email was just shown in the previous slides, and it will be shown again at the end of this presentation. So thank you and enjoy.
Great. Thank you, Christine, for that. So again, I wanted to talk about some resources that are in your state and some national resources. The Connecticut Association of School-Based Health Centers, you can see their website there, their connection for you all in your state, great resource. The Connecticut Department of Health came out with a fact sheet if you want to learn more about school-based health centers that are already happening in Connecticut. In addition, the School-Based Health Center expansion working group final report was made with the Department of Health that talks about key areas and focus areas for growth and need in Connecticut. That's a great resource. I would advise everyone to take a look at that so that's able to assist you as you're doing your application. There's licensure if you're needing that. That is the link. And again, this PowerPoint will be posted afterwards, so you'll be able to use these links and get connected with any resources that we talk about today. So let's get into the questions. So a little bit about what we're looking for. So the school-based health centers, we're looking for a place where health, well-being, and academic success is supported. If you're looking to grow in regards to outreach, primary care, equipment, mental, behavioral health, telehealth, mobile unit, dental health care, or health promotion education, then this is the RFA for you. We're looking to also look at supporting increasing access to healthcare, including COVID-19 related needs through workforce development. So if you're looking to do only equipment, we'll get into that as well. Some folks I know talked about wanting to buy dental equipment. That is helping the overall need. We just need to make sure that we're able to see that in your application. So who is eligible? So two areas that we're looking at. So you can have a school-based health center already, or you can be a new wanting to grow into a school-based health center. So a school-based health center is either located on the grounds of, or a school facility of a school district or school board, or an Indian tribe or tribal organization. So a school district can apply, a FQHC can apply, a hospital can apply. Again, we're looking at where's the need and how can you help with addressing the needs in the community. The expanded school health site is a health clinic located again in or on the grounds of a school, a facility of a school district or school board, is organized through school, community, and health provider relationships, and can be administered by a sponsoring facility. And it doesn't have to be medical and behavioral health. It can be medical or behavioral health, or we can look at outreach. Again, we want to support the need that's identified in your community. We will give extra weight to tribal-led or with a strong tribal or indigenous partnership, serving 3 or more historically undeserved communities or populations with at least one identified community or population representing at least 50% of the student population, or serving a rural area. So who is eligible? Are only FQHCs eligible? No. Can an FQHC apply for more than one site? Yes, they can. If the Department of Public Health does not currently fund an existing SBH site, is it considered a new program? Yes, it is considered a new program if it didn't exist as a school-based health site before. And if we look at behavioral health, there's this question here about if the school offers part-time behavioral health and medical care, would this funding cover expansion to full-time? For example, expanding from 2 days a week to 5 days a week. Yes, expansion is also covered with this grant. Would this funding cover behavioral health via telehealth and or medical care via telehealth? The answer to that is yes as well. Telehealth is definitely a way that can support growth in the area. Let me go backwards. All right, next question. Can a proposal for expanded school health services be utilized to serve more than one school-based health center in our district, or is it specific to one location? Yes, you can see the the eligible applicant criteria. Can an applicant submit individual funding requests to more than one location? Yes. Is there a limit as to how many applications an organization can request? If your organization is able to provide service for multiple sites, then you can apply to multiple locations, So some of the questions revolved around funding period. So our goal is to get the notice of grant award out by March 15th. We know it's a very short turnaround period, which is why we made a quicker application. We wanted to focus on the key areas, make sure you can answer those questions. We could review them and we can work to get the money out to you all. We'll have a grant team meeting March 29th, 2023. And then the contract term will be approximately April 1st, 2023 to June 30th, 2024. So is funding more than 1 year? No, it's not. Are funds renewable? No, it's not. Is the funding for 14 months only and non-renewable? That is correct, it's non-renewable. It's during this time period given. All right, there are many questions also about the budget. You can see on the right the available funding and the maximum award amount per site. The projected number of awards is varied, and based on the need identified in your application, we may give partial awards as well. The staffing tier that we had posted along with the application was a baseline. So your staffing does not have to follow that table. However, it's a baseline that we were able to work together to be able to provide as a resource. All right, next questions. More about budgeting. Is this state DPH or federal funding? It's federal funding managed by the SBHA. How much minor TA is allowed? If so, how much? If multiple years, is only 1 year. Again, only 1 year. TA is allowed up to what your organization allows or has budgeted for. And again, there must be justification. Is indirect allowed? Yes, it is allowed as part of the program cost, and it isn't capped, but must be in line with organizational policy and directly related to site costs. Are one-time costs included in the dollar amount there or in addition to it? Yes, it's included in the overall budget. One-time costs are okay. Can a request include one-time costs in year one, first 3 months, and the rest in the second 12-month period if opening occurs in September? The budget submitted should cover the funding period, approximately April 1, 2023 to June 30th, 2024. Is there a required budget and or budget narrative format? No, we left that open. We wanted to give you all the flexibility to use a format that maybe your organization already used. Again, we just need to make sure that you're following our request and your request for funds is adequately justified. Is there a cap on indirect costs? Again, no. And then are fringe benefits allowed? If so, is there a cap? They are allowed. More questions about the application. One question we have is, when you say one site per application, does that mean just one school or one district with multiple locations? One SBH site, if multiple locations, there must be multiple applications. Again, we had questions about mobile units. And yes, if you have a mobile unit, we understand you may need to attach in a document that says the different sites that you'll be going to. As in the first page of the application, there's space for one school. We did not have multiple spots for to insert that information. Is there a work plan template for the request? No, there's not. Include the requested components. Again, we wanted to simplify this process, make sure we understood what you're asking for and why, and make sure there's supporting documentation. Can an organization submit multiple applications if we have multiple sites for which we are seeking to open or expand? Yes, you must submit multiple applications. We have 17 clinics located in our schools. Do we need to submit 17 separate applications? Yes. And then we'll go to this last question. Would it be acceptable to apply in a single application for funding to support part-time rotating mobile medical school-based health services at 4 schools in a single district, or will we need to submit a separate proposal for each individual school? And this is back to what we were saying, that yes, one application is okay. Note for the site information, we'll need to note the site information for all schools. It is acceptable to attach a document. For the per site, implies per school location, correct? That is correct. For example, in our city, there are 5 schools, but I submit 5 separate grant applications if each school has its own. So again, yes, we're okay. If you have the capacity and you're able to support, then please submit separate applications for those locations. The next question is in regards to who will we grant funding to? As I said before, it could be a school, it could be a hospital, it could be a FQHC. We're looking for need, and we're looking for that to be identified and for there to be relationships identified as well. So as I answer this question here, the organization implementing the grant will be the approved grantee, whether it be the Board of Ed or a community health center. Are there specific geographic priority areas for this program? Yes. As I noted, I put a link earlier in the slideshow. There was a report that was completed that shows those areas of high need. Again, we have the link here, and we have it also in the beginning in the resources area. Next question is, can it be utilized to expand health education services at our SBH site? Review criteria for application, support work and application. Again, we want to be able to award these dollars to help expand, grow, create new school-based health centers. Again, and we just want to make sure that the work is supported and the data supports what you are trying to do. So licensure, we are not the licensing department. So we want to make sure that everyone understands that if questions do come up, there's more questions about licensing, we're happy to help. But some we may have to refer you back. We're happy to help if there's common questions that keep arising. These questions were answered by the licensing department. So I'll go over them just as they're listed here. And just want to make sure that you're noting that I gave the website for licensing in the beginning of the PowerPoint under resources. So first question, are SBHCs required to have all supplies ordered and in place and a fire marshal inspection conducted and approved in order to start the DPH licensing process? A completed outpatient clinic license is required prior to operation as an outpatient clinic. Part of the application required a fire marshal certificate and inspection from DPH. Note, for you to apply for this grant, you can start work before you complete that licensing. And we want to see that you've taken steps to start that if a license is needed, such as outreach. Outreaches can be done before the licensing gets completed. There's many other areas that you can look at before the licensing is completed. We want to make sure you note that you're not counted out for this process if you have not got licensed already. You can still apply to this application. Next question, would a mobile dental van hold a license or the school that the van goes to? We do license mobile dental vans. We require a schedule of where the van will be going, etc. The address of record is where the van is stored. If a contractor had a mobile dental unit, portable equipment that went from school to school to be set up and used inside the building, would the license be for the equipment, or at each school the equipment would be set up at? DPH licenses are generally issued for the location and licenses, and the licenses are not transferable. Next question, if a contractor provided telehealth services using one provider to services multiple schools, where would the license be needed at? If the provider is billing under their credentials, I do not believe an outpatient clinic license would necessarily be required. If not, each location would be required to be licensed. All right, so question number 6 was a question that many folks had. So we went ahead and created an example so you all were able to see that. So I'll go over the questions first, and then I'll go over the example that we have on the slide. It'll be on the next slide. So in regards to question 6, there's a table for proposed scope of services for new or expansion of existing sites. This suggests we should reference multiple sites in the application. However, the RFA specifies one application per site. Please clarify. This is to understand what the organization is doing. You're correct, there should be one application per site. For models that are mobile, they may have several sites that would benefit from their services, or for expansion of the site, which could lead to different types of services. Again, I'll go over this more in detail on the next slide. Next question. The table of proposed scope of services does not allow for any explanation what we would like to expand. For example, if we only have telehealth with mental health and want to expand for medical, only have mental health and want to expand to medical, etc. How would you like applicants to utilize this table as proposed expansion hours versus services available to be explained as a nominal answer? The next question states, the instructions state that we need to submit one application per site. However, under the proposed scope of services has a table with multiple lines. Are we allowed to put multiple sites in this table? If not, can you explain how to use the multiple rows? Great question, and I appreciate everyone sending those in. So this is an example. We have a school as Dr. Seuss Middle School. At Dr. Seuss Middle School, they have a mobile unit that's for dental. Again, as you can see in that third row, you're able to select, so I typed in medical and mental health and dental, or you can also type in your text as I did here, and I typed in mobile unit dental. Hours of operation, 9 a.m. to 3. If expansion of services, what the number of hours added? And we added additional 2 hours. Telehealth available, open during summer months, yes. Again, the same site, Dr. Seuss Medical Middle School, they're now having medical and then hours of operation 7 to 4:30. If expansion of services, what are the number of hours added? And we added 4 hours, and then telehealth available, yes or no, open during summer months. And that's how you would use this, this table here. So it's for a new site or an expansion of existing site. And you're able to state that with the expansion. All right, we had some other questions that were miscellaneous and not in the previous categories. So the next question is this related to the anticipated HRSA SSBC NOFO? No, it's not. What is the relationship between this RFP and the abandoned RFP in 2019? While there isn't a relationship, we award priority points to those who were not previously funded, which is why we have a question in the application that's asking if you had applied to that. Is there a work plan template for the request? No, you include requested components and support what you're asking for in the application. If this is for a new SBHC site school and includes staffing after the 2024 date, will these staffing funds be incorporated into future CT DPH funding contract allocations? No, this is standalone and has no bearing on future funds. Can you share the scoring criteria for the proposals? Unfortunately, we'll not be sharing that. All right, let's chat. I know we went through a lot. I want to give you all opportunity to ask questions. And we'll start with the first question.
All right.
Paul, can you assist? Thank you.
The first question is, if an applicant submits more than one application, could there be more than one application funded?
And then do you mind also putting it, oh, it's probably already in the chat already. Can you say it one more time?
Sure. If an applicant submits more than one application, could more than one application be funded?
Yes, great question. And yes, we will fund more than one application. Again, we just want to see that the work is supported by the data given and that you're able to support any requests for funds. Great question.
Okay. The next question, is there a school-based health center if there is a school-based health center in a school district, can another organization provide behavioral health services under mental health as a separate provider if the district is in need?
Yes, so I can answer for what we'll fund for, but we want to see that there's a relationship. So before engaging in that, I would say make sure you're talking with that district to make sure that there's a agreement there, an interest, so that you can move forward with the school. So from the outside, I can say, yes, you can go ahead and apply, but you need to make sure that there's a relationship with that school, and that's something that they've agreed on. Are interested in. Thank you.
All right, so the next question is, if we are expanding staffing but not expanding hours, would that still count as an expansion?
Good question. I think it would go towards workforce development or growth. And that's something that we are looking at. We want to see what data is supporting that growth with those additional employees. So how is that supported with your application?
Okay. So the next question is, if we aren't expanding services, but are seeking funding for new equipment, can we leave the expanded services column blank or enter NA?
Say that one more time, please, Paula.
If we are not expanding services, but we are seeking funding for new equipment, can we leave the expanded services column blank or enter NA?
yes, but we will want to see, again, justification. So is the equipment breaking down? What are you trying to do with adding this new equipment? Because our goal is to expand services. So we want to see how will the clinics, how will the center, how will the students benefit from this addition? That would be okay.
So what is the new equipment making possible?
Correct. Mhm. Again, going back to need. Thank you, Paula.
All right. We do have a question about the state sustainability plan for the newly created school-based health centers, if this is a one-time funding. And I anticipate we don't have an answer for that since it is one-time funding.
Correct.
All right. If we are a school-based clinic and want to expand, can we add an extension site at another site without licensure?
So according to what licensing has told us, we are understanding that that site would need a license.
And they would verify that with the licensure department, the committee department. Okay. So can these funds be used to hire a nutritionist as an expansion for health?
Yes, that's great. We like those that are thinking outside the box. So that's definitely okay. You're expanding services to the students, and that would be acceptable.
Thank you. So the next one is, we do not have access agreements because all of our school-based health clinics, dental and medical, mental health are licensed outpatient clinics through the Connecticut Department of Public Health. Where can we state this on the application since the question is only a yes or no?
You can state that. I'm going to bring up the application so I can note where is the best place for that. Give me 1 second. Okay. So question number 2, it says organization, mission, vision, and purpose around SBHCs. How long have you been providing SBH services? You can note it in that area that you have already what your current model is and that you already have licensing. That is perfectly fine to put it in that area.
So the next question is, you stated there will be priority points for those not funded in 2019. The questions asks if we applied, not if we were funded. Will you have access to whether or not we were funded if we applied, but not funded?
Yes.
It does not ask that.
Yeah, we will be working with the Department of Public Health to note those who applied. We'll be able to know the status as well, as no one was funded.
All right. So the next question, if we have existing school-based health center sites, but they are not funded by the Department of Public Health, and we want to expand from just behavioral health to include primary care, are you saying we should check new school-based health center site, even though it is an existing site?
See that one part at the beginning?
If we have existing school-based health center sites, but they are not funded by the Department of Public Health, and we want to expand from just behavioral health to include primary care, are you saying we should check new school-based health center site, even though it's an existing site? So it's an existing site with mental health, and they're looking to add primary care. Should they check new school-based health center site, even though it's an existing site?
As a physical site is current and is operating, then that addition to services would add as expansion. Now, if it was a site that was brand new, say Dr. Seuss University, then Dr. Seuss University would need to go ahead and they would be brand new, never in school-based health center, never had anything operating. didn't have anything licensed, they would be brand new. But if you already have that and you're starting same school, something new, then that would be expansion. Now, if you are a different school, or you're, say, FQHC, for example, that has a FQHC, has a school-based health center, but they're going to go to a different site, a different school, then that would be 2 different applications. So one, if you want to expand the one that exists currently, but then you want to go to a totally different school, that would be another application. So application for new school where you are not currently, and then if you want to expand where you are currently, then that would be an expansion. But it would be 2 separate applications. And if I'm not hitting any of these questions, again, after we go through the question that Paula has, I see Sherry has your hand raised. If I have not answered them and they're still confusing, please, we'll give you an opportunity to unmute and you can ask the question.
All right. So the next question, it's a comment. There is no box for expanded school site on the first page. We want to start a new site for behavioral health only.
So say it one more time, Paula.
There is no box for expanded school site on the first page. We want to start a new site for behavioral health only.
Okay, so on the first page, it says site information, name of school, address, website, telephone. Then it says SBHC type. And then it has SBHC expansion, providing medical, mental health or other. So behavioral health would go underneath the mental health. If that's the box, the page that you're referring to.
And then we did have some clarification around the access agreement question, and the license and access agreements are different, and it would be a new site. I believe I captured that one correctly.
Yes. Okay. Are those all the questions in the box?
No, there are several more.
I'm going to take a break and then I'm going to have Sherry, because she's had her hand raised, go ahead and we'll ask you to unmute and you can go ahead and ask your question.
Thank you. I appreciate that. I just wanted to, I feel like there's a nuanced difference in how the question's being responded to as it relates to, is it a new or an existing application? Because the question, at least one that we have, it's if it's a site that is not funded by DPH. For example, we currently have sites, they're licensed by DPH, but they're not funded by DPH. Would that be a new site or is it an existing site?
Thank you for clarifying that. Thank you. So it's a current school-based health center.
Yes.
And so with that, then it would be not a new site because of the funding source. It would be an expansion if you wanted to go ahead and grow from where you guys currently are. Does that answer the question?
Yes, we have 2 existing school-based health centers not funded by DPH, and we're intending to expand the services, but wanted to clarify that in fact, that is expansion.
You are correct. It is expansion. So thank you for asking that question in that way. I appreciate that. So
Thank you.
Regardless of your funding source, if you exist as a school-based health center, you're recognizing you're a school-based health center, regardless of where your funding comes from. Thank you, Sherry.
Thank you.
Thank you, Teresa and Sherry. All right.
Next question.
So can the funds be used for electronic medical record upgrades that support telehealth?
Yes.
All right.
That's exciting, actually. I like that. Thank you.
Yeah. So we answered the funding part. Would you consider letters of support?
I am not opposed to letters of support, and I know we went back and forth to page numbers. And I need to double check. Yeah, I'm not opposed to it, and I'm double checking here for application if we limited the number of attachments. Again, it's a short turnaround. We wanted this to be as clear and concise as possible. The agreements are much more helpful though. But if you don't have that, in place of that, you can tell us, provide letters of support. Again, we did not ask for it, but if you feel that will help your request for funds, then we are not opposed to that.
You, Teresa. So the next question is, what do you consider historically underserved communities? And where would you like to see that information under the need?
Yes, and the report that the Connecticut Department of Health completed has areas noted on there. So you can look at that report to help guide that question.
The next question, if you're looking to provide service to multiple schools and you need to apply in multiple applications, then they could all be for $250,000. Example, 6 schools, 6 applications, and funding of $250,000 each.
Correct. That is correct. So 6 different sites, 6 different needs. Yes, it could be funded for that amount of dollars based on the need. Again, we're just looking for you to support that. And again, depending on how many applications, what the requests are, we'll be doing partial funds as well.
Meaning that it could be up to, but it 250,000, but it could be less than 250,000 based on what you need.
Yes, correct.
Okay, thank you. So what is site within the school district, being a city, that serves multiple schools in a school district by transporting children from those schools, but is itself not an active school, a former school or church or other building that's been converted for clinical use, be eligible for this funding? So let me read this again. If they're serving students by transporting children from schools to an off-site location, I believe is what that says. And that's in the chat, Teresa, if you want to look at it. What a site within the school district that serves multiple schools, transporting children from those schools to a central building, be eligible for this funding?
I'm needing a little bit more information. The person, oh, go ahead.
Let's see if they will unmute.
That was, let me see. If you raise your hand, we'll know who you are so you can get, oh, there you go.
Yeah, I can just, we're interested to know if a building that's not itself a school, but that could serve the, 3 to 5 schools that are in close proximity to it as a central opportunity for the kids in those schools to get school-based health services, essentially, but isn't itself a school, be eligible for this funding.
So, but your organization is a FQHC, or because you guys are providing the healthcare to the students, but students are kind of coming to it, like say, for example, like a YMCA, they're coming to a central location. Okay, so
let's get back to this question. I think we'll have to get back because I think it has to be on the school grounds, but let us
To be on school premises. Okay, that's what we were wondering. Thank you.
Yeah. Let us get back to you.
can you send an email? Let me go back to the email address. If you can send an email there, then I'll reach out to you to discuss in more detail. Thank you.
All right. So the next question is, we have a school-based health center at one school in the district. We want to add a mental health provider who travels to other schools within the district to provide counseling. How would we apply for this as an expansion? And what if any licensing is needed for at the other schools? So let's start with the first question. We want to add a mental health provider who travels to other schools within the district to provide counseling. How would we apply for this? Is it as an expansion?
So again, I think this is going to be a specific one, but I'm going to ask some questions as I talk through it. So the first question that comes to my mind is that mental health provider going to establish school-based health centers, or are they a school employee that is assisting in expanding school health services and not school-based services? So I think we're going to have a little bit more of a discussion to figure out kind of where this is coming from, and support that answer.
So I
Wondering,
think that it's okay for the staff to split time at multiple sites, but you're going to have a license for each of the sites. And then let's see.
and then is it school-based health center, supporting the school-based health center, or is it supporting the school, for example, the school resources? So is it a school employee that is providing mental health assistance, or is a school-based health center employee that's providing assistance to the school? So I think we have to look at where that person's coming from, where they're going, and how are we expanding school-based health center services or expanding school-based health center services. And that one, again, that person, if you don't mind sending me an email, I will contact you directly to make sure we're able to answer that question.
I believe it was Judith. All right, so the next question. Can the application include funding for a school nurse in addition to the community-based services?
Is a school nurse supporting the school-based health center? Is that expansion? Because again, we're looking at school-based health center and how are we expanding or creating a school-based health center? If they're doing school health services and that's apart from the school-based health center, then we have to go back to original question of what the grant is trying to accomplish.
So a school nurse in general should not be included, but a school-based health center nurse could be.
Correct.
Okay. Thank you. All right, so the next question. The last question in the application references the identified salaries noted above, but I do not see a question about staffing or salaries. Where do we include that information?
I'm going to the last question.
Is that in the budget, Teresa?
That's in the budget requirements. And I think they're referring to the financial profile, but let me go back and look at this real quick. Okay. All right, and can you ask the question one more time or repeat the question?
So the last question in the application references the identified salaries noted above, but I do not see a question about staffing or salaries. Where do we include that information?
All right, great question. Thank you for that. So I'm going to the application and we have the financial profile. And let's see.
In the budget?
Yeah, because we didn't clearly state that, so I see why that's confusing there. But in the financial profile for 13, provide a sustainability plan detailing how service will be expanded or sustained utilizing funds outside of those provided through this contract. That could be provided there. And then the budget narrative, that could be an attachment as well. where you can provide the line items. So it was not clear in the application, but we did attach the breakdown of the salaries to be able to assist with that. Again, I think we had the question about the budget and salaries and where, if that was what was supposed to be used, that's just supposed to be a guide. But if salaries are above or below that, that is okay as well.
Thank
So
you.
no, it was not clearly noted, and thank you for bringing that to our attention. But you can go ahead and put it in the area I noted, which allows for a little bit more explanation of what the ask is.
Okay. So the next question, does funding cover exam tables, medical equipment, and etc.?
Yes, that does. Again, just support that. We want to help support your school-based health center. Durable medical equipment is included, staff time is included, everything to get you set up to be able to do that. And we did provide, let me go right here, underneath projected number of awards. It talks about funds may support varied operational costs, including personnel and supplies, as well as one-time costs related to equipment purchases and minor alteration and renovation, as well as it goes into telehealth and what could be included with that.
Thank you, Teresa. The next question, is there a template for the access agreement? And the answer to that is there is no template for the access agreement. Each organization uses their own format. Is that correct, Teresa?
That is correct. We have our resource page here as well. The School-Based Health Alliance has many resources, and there's examples of access agreements that you can access by looking at the blueprint resources. They're listed underneath there.
Okay. So the next question is the 250,000 potential award per site or per application? We are submitting for multiple sites. I think you've touched on that, but let's clarify it again.
Yes, per site. So if you are ABC FQHC and you are applying to 5, 6, 7, 8, 10, 20, if you're ambitious locations, then that would be separate sites, and 250 up to 250,000 could be awarded to each of those sites. There's not a cap based on who is applying, it's on the location. We're looking specifically at the location.
All right, so the next question I think we've touched on, but it asks, can we apply for expansion at our current school-based health centers? That answer is yes.
Mm-hmm.
And then the second part, and for a new center at a site, we would like to open off school grounds.
So the off-school grounds, is it still servicing students going to a school? Get the person that asked that question unmute if you don't mind.
Hi, good morning.
Morning.
This is Tanya Dimbo. I'm the director at Dr. Robert E. Appleby School-Based Health Clinics. And I'm very new, so. Yes, it would be offering services to the students in these schools, but also to students coming into school that maybe aren't registered.
Okay, so it seems like it's school linked, and it's not necessarily on a school campus.
And
Right.
then the students get there.
Mm-hmm.
I'm sorry, I missed.
How would the students get there?
Their parents.
Okay, so I think great question. I think we can go into a little bit more detail with you because we're also looking at sustainability. And is there a connection? Or is the school interested in
Yes.
this as well? Is it walkable? How are they accessing it during the day? Is that an option? Is it possible? So I have several questions for you.
Okay, great.
Send us an email, please, because just when we step back, it is similar about the other question, and the school-based health centers should be at the school location, but send your nuances so that we can get clarification on that for you.
Okay, wonderful. Thank you.
All right.
Next question.
If the award is less than the application's budget items equipment, is an amendment needed?
Say that one more time.
If the award is less than the application's budgeted items and equipment, is an amendment needed?
We are in a short time frame. So if we're expecting folks to spend down, and we understand maybe the equipment cost or something may have changed. So we would work with you to see how we can address that. And if there needs to be, adjustments, then we would work with you to make sure we're able to help you spend down those funds.
Thank you. And then I am seeing in the chat, Melanie Wildlane, thank you for offering a template for access agreements to anyone, and your email address is in the chat. Also, we have a link to the Connecticut Association for School-Based Health Centers in the resource page. All right, the next question. Can the funding be used to purchase a mobile clinic vehicle to service multiple sites?
When you say multiple sites, is that multiple school-based health center sites? Or is that one site is a school-based health center and they are servicing other sites outside of school-based health center? If they're servicing school-based health centers, yes, it's okay to request for funds to be able to service multiple school-based health center sites.
The question is whether a mobile school-based health center can be purchased,
Yes.
Being a drivable mobile? Okay.
going from school to school.
Yes, that's also allowed. Mhm.
Thank you.
Great question.
The next one is, can a Board of Education building be used? And I think that goes back to the other questions around location and where that will be, and if it's on the school grounds. But if you'll shoot us an email, we will look at that.
Yes.
All right. They're asking where the RFA application can be found. And
We can put it in the chat for you.
yeah,
Put it there right now. Application at the very bottom of the page.
all right. So the next question. When you mention partial funding, does that mean if someone submits for $40,000 per site that you might fund less than that? Or if submitting for multiple sites, would partial funding mean funding, for example, the 5 of the 10? When I said partial, I meant if your budget was less than $250,000. Good question. All right. Any hands up, Teresa?
I don't see anyone. If you're unable to put your hands up or can't find it, feel free to unmute. And we'll answer them as the questions come. Go ahead.
We have one more question. Can you list the attachments you were expecting to see?
Great. Yes, I can. Going to go to the application. All right, so when we go to the application, let me do this real quick. I'm going to stop sharing and then I'm going to show the application. All right. All right, so here's the application. And we're gonna show, I'm gonna go ahead and go through this real quick. So as you all know, the first page, we went through everything we're looking for, hope to see as far as applications. Again, we note here 1 site per application. And we have the grantee requirements. And then we go into some of the items that we're needing. So as noted, we did note here, the SBHC Connecticut salary tier is to be used to help calculate how much funding you're requesting for staffing per site. Funding requests should follow the noted salaries below. If asking for higher salaries, please justify. So we want information on salary. And then if we go down here, we have, this is where we start the application, okay? Go through. We note here, we want it to be size 12 font. At any of these fonts, single space. And again, there's area for you all to type, but we try to make it easy when you can check a box to check a box. So we're going down here, let me go backwards. Okay, so this was an area that created some confusion, the site information. So if you have a site and, for example, you're a mobile unit and you're going to several sites, this is where I said that you can attach a document saying the several sites. It's just easier to type it in versus trying to get it into this space here. You can type into that, but again, if it's easier, just so you can have the 5 your sites noted on a different document, that can be a separate document. We didn't note that when we were doing the application, so we didn't create several sites for you to write the site information. So that can be a separate document. So that's the first. All right, so if we go down here, talk about your existing sites, give you spaces to identify those. If you need more, that can be an attachment. Okay, we talk about the organization's mission, vision, purpose. That will fit here. The max is 300 words. Do you have an access agreement? Again, if it's yes, then you can go ahead and attach that. And that's permission to provide service in the school location where the funding is proposed. Again, this is what I had noted would be more beneficial, not that we don't want letters of interest or intent or letters of support, but the access agreement is beneficial. And again, it must be in place within 30 days of the funding award, which is why we would say that try to get those sooner than later. Next talks about licensure. No attachment needed. No, just some dialogue here. Have you started the process? If you need to write anything else, there's information you can write there. Do you have experience and a capacity to collect and analyze electronic data with electronic medical records? If yes, please describe which EHR you use, yes or no, and then you have a space here to describe. So this is where we talk about Dr. Seuss. Again, for new or expansion of existing sites and or where you can write that information here. This is the drop down menu that I had shown you where it has choose an item or text. So you can type in here and then it does say etc. So if it's outside of this, that's okay too. So let's say we're doing health education. You can include your information, whatever it may be here. Non-attachment there. Next, marketing outreach. Do you have family or student satisfaction surveys? This is an attachment. So we're looking to see, we want to see what documents you may have. Describe marketing and outreach strategies to reach youth and families for SBHC service. Attach 1 to 2 examples. Again, we are looking for an attachment here. If you do have it, if you don't, then no attachment. Statement of need, we're looking for that to be words, 300 words max. Describe community economic needs or health disparities. Does the site have free or reduced lunch available? That would be a yes or no. and you'll describe any other measures of need. Again, another area for attachment for work plan, attach a work plan with measurable objectives describing tasks to be performed, deliverables, and timelines, including a project start date. No more than 2 pages, please try to keep it succinct, but this would be another area for attachment. Next, if providing medical services, describe the plan to target vaccine administration, including mandatory preventive and COVID vaccines, COVID mitigation, education, testing, and contact tracing. Again, 300 words, not an attachment. Financial profile. Provide a sustainability plan detailing how services will be expanded or sustained utilizing funds. Next, describe your plan. Again, 300 words. Budget, we are looking for either you can put it here or you can have an attachment. I did not note that here, but an attachment is okay, especially if you have it in your organization's format already. We wanted to make this as easy as possible, so you didn't have to put it in our format. So it tells you about the salaries noted above, and the salaries was the document that we actually stated in the front that the Department of Health worked on. So that was the document that we referred here to. And then what other expenses do you anticipate, including startup costs, if applicable? Please provide the line item and cost. This can be an attachment, that is okay. It's not noted there, but this can be an attachment. And again, I know this question came up and I noted where else salaries could be noted, but the document, this is referring to the document that is on our website that is talks about the baseline salary, the SBHC Connecticut salary tier, and that's on the webpage for the application. All right.
Right,
Next
Teresa.
question.
Any additional questions? I see, I don't think we've touched this. Can you share here the link to the report on the portal that includes the areas of high need?
Yes, I will do that right now. All right, any other questions? If you can't find the unmute button, feel free to raise your hand or unmute yourself.
So the next question is, if we want to hire a family engagement worker, should we add that to the new site section? Like you added the health educator?
Yeah, so that's perfectly, if that's what you're expanding, is that what your expansion is? That could go there. Yes, it could. And then what website will this recorded meeting be available? We'll post it on the same place where the request for the RFP is noted on the School-Based Health Alliance website, along with the PowerPoint as well. Next question.
All right, so let's see here.
All right, I see a question by Adam. Thank you for reviewing what has been attached. What was the mechanism for attachment? Attach the email, and did you say the access agreement should be attached? Yes, please attach the access agreement, and yes, it would just be an attachment to the email that you're sending.
Thank you, Adam. And then we have one from Dennis asking if we added a new insurance enrollment role to serve all the existing school-based health centers, do we need to split out hours in 5 different applications? Dennis, unmute.
All right, so can you say it one more time, Paula?
Okay. If we added a new insurance enrollment role, so a person, to serve all the existing school-based health centers, do we need to split out hours in 5 different applications? So they're hiring a person to assist with insurance enrollment, and this person will work across multiple school-based health centers. How I'm reading that.
Yeah, and I'm guessing the budget for that, for the 5 different schools, it's going to be a portion, and I'm assuming that all 5 budgets for each school is going to be different. So it'd be a percentage of their time across the 5 schools.
Yeah, so 5 different applications.
Yes. Mhm. And I posted the link, but I cut off the HTTP. There's that.
And then, so there would be different applications, I would think, and then showing how much in each school. I'm seeing these questions come up in the chat. So that's where I'm pulling them from. All right. See you. Thank you.
Okay. All right, and does anyone else have any questions? I may be missing some. Moving. And we have the question and answer box as well, in case you're not seeing. We have chat and Q&A. Let me see. I don't think we went over this one. After operational site visits.
I didn't understand that question from Rose. It was related to HRSA, HIV/AIDS Bureau, and what they require.
Okay, Rose, if you don't mind, if you can email me, I would like to answer your question. I'm just have a couple more questions to follow up your proposed feedback.
And then Charlene asks if you would please, if you do you mind sharing again the due date?
I do not mind sharing at all. I'm going to go right here. So the notice of grant award is March 15th. And then our due date we have on our wonderful application. And I did not commit it to memory, so I have to look it up.
I have it. You got it?
February 24th, right around the corner. The submission deadline is no later than 11:59 p.m. So you can do it all the way up to midnight. All right, any other questions? Thanks for putting it in the chat.
All right, we have another question. We have multiple school-based health centers. On the application where it says site information, do we add one of our main schools?
So it depends on what you're trying to do. So it sounds like you have school-based health centers already. And then are you a mobile unit? So, is there going to be expansion? We're also looking across the board sustainability. So where your multiple schools would go would be on page where it says current site and organization information. The site on the first page, which is the applicant information, then it says site information, where is going to be where you're going to work out of. So is that expansion at that specific school? Are you adding a health educator? Are you adding a provider, increasing hours? That's the school information we're looking for under site information. Does that answer your question? Feel free to unmute if I didn't answer it correctly. All right. If you're able to unmute, Champagne. All right. And you can feel free to email me. Oh, we would be looking to expand all sites. Our school-based health centers are in different school districts. Okay, so that would be different applications for each site then.
Meaning one application per school-based health center site.
Correct. Mm-hmm. All right, any other questions? All right, so we have our contact information here. I'm going to share my slide deck as we close. If there's any other questions, we are here. We want to support you. We want to help you as you request funds. If you have questions that were not answered today, then please feel free to reach out. The email address that was given. And if you're still having questions next week, again, feel free to ask the questions. We're here to help. We want to help you, and we want to make sure that you're able to get your project funded. I'm going to share my screen again, and then we're going to go towards a close, and then we will have opportunities. We'll stay on until the end. In case there's any lingering questions. All right, so as we close, and thank you, Jill, very nice seeing you. We're gonna go ahead and I'll show you the last couple of slides that we put together. Again, with resources, we want to see you all get funded. We wanna make sure you're understanding the application. We are here to help you. Again, please stay connected with us on all social media if you have them, if your organization has them. We do have resources and tools. This is my contact information. Please send your contact information there. There's a team of us that'll be working to answer your questions. So we are using this email address throughout this funding cycle. As already noted, the resources, again, as you look to starting a new school-based health center or possibly growing what you have, there are plenty of resources. We at the School-Based Health Alliance have worked with our national partners to create for folks like you. If you're looking to plan and start a new school-based health center, this is a great planning checklist I do recommend. It's on our website, so you can look at more under what we do and services. If you're looking to start up telehealth, we did work with our partners to make a telehealth program playbook. You can get more information by visiting sbh4all.org, SBTH playbook. Lots of great information, gives information about technology and equipment. Again, we want to promote and support new endeavors, as well as the increase and the growth of current school-based health centers. Last, we do look forward to seeing and hearing about your growth. We do have a conference that's coming up in person since before the pandemic. It's been a while. We do look forward to seeing everyone, and we are looking to celebrate workforce. Workforce has been working hard. All of us in healthcare. I myself, previously to this position, was a school-based health center manager, and COVID was difficult. We have worked hard. We continue to work hard, and we appreciate all the work you all are doing in the fields. That is all I have for today. We will end now our recording. And if you have additional questions, please feel free to ask us. We'll be here until the hour is over. Thank you, everyone.